Kisoro District Chairperson Bizimana has called on the Ugandan government to ensure the effective utilization of the consolidated fund to meet the healthcare needs of its citizens. Bizimana made these remarks during a healthcare awareness camp organized by the Judiciary and the Uganda AIDS Commission at the Kabale High Court premises. He noted that instead of worrying about potential challenges faced by HIV patients following recent statements by former US President Donald Trump regarding aid to developing countries, Uganda should focus on self-reliance. He urged the government to leverage on the consolidated fund to strengthen the country's healthcare system and reduce dependency on foreign assistance.
Must be a substantive responsibility of the consolidated fund so that we don't get these shocks. I believe that we correct taxes. And why should Ugandans depend on foreigners, on the health of its own people? If our budgets cannot support the health budget, then who are we supporting? Sometimes when I say this, they say, is Bizimana not an opposition? But we also track funding from our taxes and other sources of funding. And when we track the funding of healthcare and the budget that goes to our health, and you find that the proportion coming from consolidated fund is too tiny, then we shall wonder whether those who sit at the decision table mind about the health of Ugandans in the first place. So we would rather borrow for any other thing, but our health must be cared for by our own taxes. I think that is more prominent.
At the same event, judicial officials and representatives from the Uganda AIDS Commission reaffirmed their commitment to combating HIV/AIDS.
To show our commitment, the judiciary has embraced guidelines to fight HIV, and among the achievements in the implementation of the HIV/AIDS activities. These include 1. Allocation of resources for implementation of HIV/AIDS activities. 2. Development and sensitization of the staff on the judiciary HIV and AIDS workplace policy. 3. Medical financial support provided on quarterly basis to staff who declare their HIV status. 4. Effective referral of staff identified to be living with HIV, access ART.
We have had a 12.9% reduction in HIV prevalence from 18% recorded in the 1990s to 5.1. So that's a 12.9% reduction. We have had 61% decline in new infections since 2010, and we have had a decline in deaths, in AIDS-related deaths by 57%. In terms of the 95 targets, where we say 95% of the population should know their HIV status, and of those that have tested and have known their status and they are positive should start on treatment. And then the 95, those that have started on treatment are able to virus suppress. We are at 92.
Local authorities also emphasized the need for collaborative efforts to improve healthcare at the community level. According to the latest statistics from the Uganda AIDS Commission, Uganda has 1.49 million people living with HIV, with a prevalence rate of 5.1%.
As members of the judiciary, you play a vital role in upholding justice, promoting human rights, and serving the community. Ladies and gentlemen, and honorary members of the judiciary, AIDS is a public health concern that affects not only individuals, but also families, communities, and societies as a whole. It is a disease that knows no boundaries, affecting people from all walks of life, regardless of their social status, economic background, and professional. As judges and magistrates, you are critical role in addressing the socio-economic impact of AIDS. Your decisions can help to reduce stigma and discrimination, promote access to health care, and protect the rights of people living with HIV/AIDS.
Kabale District has offered this land where we have these offices. And sometimes back, we even requested to have Court of Appeal here in the Kabale Kigezi. And you are ready to give more land. So Kabale and judiciary, we work hand in hand. So I will not talk much, only that I want to thank you for initiating this and inviting us to come to this very important event. And really, we appreciate for what you are doing to our people. We can't take for granted.
In 2023 alone, the country recorded 38,000 new infections and 20,000 AIDS-related deaths. Young people aged 15 to 24, particularly adolescent girls and young women, remain the most vulnerable demographic. Bizimana's remarks come at a time when concerns over the external aid cuts have raised questions about Uganda's ability to sustain its health programs. Experts have long argued that domestic funding strategies, including better allocation of national resources, are crucial for long-term health service delivery. The Judiciary and Uganda AIDS Commission continue to advocate for policies that strengthen access to healthcare and prevention services, particularly in rural communities. This story was compiled by King Solomon Tunamasko and Norbert Ndiamhachi for Kigezi Television.